All right, so that brings us to our last presentation for today that is facilitated by Teresa, Lillian, and Amelie. Together, they will describe aspects of the Navigator program, which has been collecting information on gaps and solutions to some of the major challenges that parents experience when caring for their child who experiences some degree of medical complexity. But by sharing what works across Canada, the group has created a national toolkit website that's called Changing Your Lens, which houses the resources and tools that's needed to educate, help build awareness and capacity within hospitals, community organizations, as well as for primary care providers and employers on how to better support parents. So with that, Lillian, I'm going to hand over the podium to you, and you can get started.
Good afternoon, everyone, and thank you for being here. So today on our team, there's me, Lillian Pitcher. I'm one of the parent navigators. And Teresa, another parent navigator, and Amelie, who is our social worker, is going to be doing the presentation with me today. So today we will talk about our website, changingyourlens.ca, a website which was created with the focus on parents of medically complex children and a guide for care providers and organizations in how to better support them. The Navigator program is a 5-year federally funded program intended to help address a critical gap in supports for parents of children with medical complexities. Since January 2016, the program has provided dedicated expert resources to minimize the social, emotional, and economic impact of caring for a child with medical complexities. The program has 3 different types of navigations that aids the supports that families need. So we have system navigators, and they provide psychosocial support to parents with a social worker. Parent navigators, that is the role that I am in. And as a parent navigator, we have lived experience and provide peer-to-peer support to our families. And then we have knowledge navigation. This group provides information gathering to develop more effective tools and strategies to support parents and caregivers. The Navigator team identified major gaps and challenges that parents experience when caring for their child with medical complexities. To gain this information, we consulted with family groups, individual families, and social workers that work with these families. We also did literature research and gray literature research from system-savvy parents who are active bloggers or publishers. We also did a webinar on the Children's Healthcare Canada Knowledge Exchange Network with a national audience of parents with complex care children and healthcare professionals involved in their care. The webinar validated common themes and issues we identified during our research. Teresa, who is the other parent navigator, will now talk some more about the challenges our parents face and how you can find the information on our website.
Thanks, Lillian. So parents of children with medical complexities experience negative social, emotional, and economic impact for caring for their child. This is just a slight overview of some of those challenges. ChangingYourLens.ca is a toolkit that was co-designed with parents and 15 centers across Canada to increase awareness about families' lived experiences using various mediums, such as video documentaries, a parent's experience, documents, and infographics. The goal of ChangingYourLens.ca is to help team members across Canada be better equipped to support parents of medically complex children and youth. ChangingYourLens.ca can be used to educate employers, pediatric hospitals, staff and pediatric community organizations, and primary care providers who support these parents in their offices. ChangingYourLens.ca assembles collective knowledge and educational material from across Canada. It includes practical resources ready to use or replicate for your own organization. ChangingYourLens.ca has been visited 1,451 times between October 1st and December 31st of 2019. And our most visited page has been supporting emotional and physical health for parents. Each section on Changing Your Lens contains the following information. We discuss the gaps and barriers that families face, what has been done, and some quick guides and resources, as well as an inventory of practical information. This is a video on Changing Your Lens. It's a day in the life of a medically fragile parent. Some organizations have used this video as a training for new staff, excuse me, to give a perspective of what it takes for one of our medically complex families to come for an appointment. We also have a documentary on trauma. Excuse me. Parents share their stories of trauma of caring for a child with such high medical needs. This video includes a one-pager of guidelines on how to view and share this video since the contents are very sensitive. We wanted to make sure that our families sharing their stories are respected in every way possible. By sharing these videos, it gives organizations an opportunity to allow for capacity building and to use for educational purposes. You can find this video on changingyourlens.ca under the Social Isolation tab. Parents experience many challenges in their emotional and physical health. Parents experience grief, anxiety, depression, and post-traumatic stress disorder related to providing care for their child or children with medical complexities. Parents are frequently exposed to triggers that bring back memories of trauma related to past medical interventions and medical decline and care needs for their child. I'm going to pass it on to Emily, who is the social worker in our program.
Thank you, Teresa. So social isolation for family greatly impacts their health and well-being. Sorry, I'm not at the right slide. Sorry. Parents incur significant out-of-pocket expenses on equipment, therapies, transportation, special diet, respite. This also includes the cost of parking and gas for the various hospital visits and appointments. The total economic cost to Canadian families of children with complex special needs range from $20,000 to $60,000 per year, with an average cost of $30,500 per year. Parents are also responsible for navigating the complex web of federal, provincial, and municipal supports in order to receive financial assistance for their child's medical needs. Social isolation for families greatly impacts their health and well-being. Parents are their child's lifeline. When parents are not well, their children are impacted. The role of a caregiver is all-consuming. Parents speak of not being able to turn off the caregiver role and are uncomfortable stepping out of the role that they are very familiar with. The Navigator program hosts various events throughout the year. Our annual Family Fun Day, a holiday party, caring for the caregiver support group, and our ever popular self-care challenge, where parents are tasked with focusing on themselves once a day, even if it's for a small amount of time, and they are entered into a draw to win amazing prizes. Families are increasingly isolated during peak illness times, 4 months of the year, because it is unsafe to see others due to the risk of catching something. As you can imagine, with COVID-19, our families are even more isolated. Some families are choosing not to have nursing or respite care in their home as to reduce the risk for their families and children. Our families struggle with the idea of they themselves getting sick, and who would care for their children. The Navigator program has set up virtual groups for families since the beginning of the pandemic. We host this group on Zoom with 1 or 2 social workers and the parent navigators present. We will sometimes have discussion topics, or we let the group organically discuss what comes up. So in this section, you will find resources related to the development and delivery of the Navigator program. The resources include job descriptions, tools, media, videos, and activities that we have hosted for families. All of the posters we have created and any training that our team has taken. We want changingyourlens.ca to help improve how our system supports these parents and therefore their children across Canada. And going forward, we invite the nationwide stakeholders to use these resources to increase level awareness, build community capacity, identify sustainable solutions, help families of children with complex medical needs across Canada. Let us know what we are missing. Share what you are doing by emailing us at navigator@chio.on.ca. So these are our acknowledgements, and we thank you for listening in to our presentation today, and we will now be ready to answer the questions. And these are references.
All right. Well, thank you so much to Emily, Lillian, and Teresa for sharing the project that they are involved in. Thank you so much for still remaining on the line. And I guess if anyone has any questions, feel free to relay those through our online platform again. But I guess I can get us started. And I guess the general question I have is, you've mentioned some of the uptake that you were, or the interest that you saw back in the late last year. What is the national sort of uptake that you have seen so far across Canada?
Can you say, what was that last part again, Pierre?
Sorry, so I was just essentially asking, like, what have you seen in terms of the national interest or national uptake of the Navigator program in Canada?
Well, we've heard from organizations across Canada that they use our videos. I think the probably like a key piece for us. And people are using it in training for nurses, in training for staff at hospitals, and people are using our one-pagers as well. Like we have statistics, I don't have them on me, about who's visiting and what they're visiting, but we do know that the website is being utilized, and we've heard bits and pieces from people who have used it, and we would love to hear more. So if anybody's used anything, please.
Wonderful. And I guess I should mention as well, in the follow-up email after the session, we'll be sure to include links to the videos that were referenced in the presentation, so you can feel free to review those as well. So the audience, we did get 2 questions, and I am cognizant of the time, so if you could, I guess, keep your answers brief, that'll be great. And again, if you feel like your answer is not fully addressed, feel free to connect with me afterwards, and we will put you in the loop with the presenter. So Lillian, or one question we had is whether the Change Your Lens website is bilingual. And whether in that are they paid or is it on a voluntary basis?
So do you want myself or Teresa to sorry?
Oh, so whoever is most comfortable answering the question.
So our role is we both, Teresa and myself, we both work about 20 hours a week, and we provide peer-to-peer support to our families. We also do a lot of activities for the whole families, and then we also host activities just for parents too, just to help them with planning and developing ideas for how to best take care of their children.
Great. Thank you so much for sharing. So I know we're a bit over. Thank you so much for staying with us again. That brings us to the end of our second session of the 2020 Child Right Virtual Symposium. Thank you again all for attending. And of course, a special thank you to all of our presenters who were facing their work today. And just lastly, I want to make special mention of our communication team. And of course, the third part of this series to visit our event page on the top website and registering. As I mentioned before, we will shortly follow up with you to request some of your input on the session, what could be done better, and of course share some of those resources and links that were referenced in some of the presentations today. And lastly, if you have any further questions, feel free to connect with me by email. I will it's been cut up on your screen, but yeah, you can just feel free to email me, and I'll be happy to connect and chat some more with you. So again, thank you very much. I hope you enjoy the rest of your day, and we look forward to seeing you on Friday again. Take care. Bye.